When a patient is struggling to breathe or showing signs of metabolic distress, we need a clear picture of their internal chemistry, and arterial blood gas provides critical data points that go beyond a simple pulse oximetry reading. We are not just looking at oxygen, we are investigating the delicate balance of acid and base in the blood.
The main values we monitor are pH, PaO2, PaCO2, and bicarbonate. The PaCO2 reflects how well the lungs are removing carbon dioxide, while bicarbonate represents the kidney's metabolic response. Together, these values reveal if the body is in a state of acidosis or alkalosis.
To provide the best care, remember that an ABG result is not just a single number, it is a clinical pattern. Nursing interventions depend on whether the imbalance is respiratory or metabolic in origin. By understanding the whole pattern, you can treat the underlying cause rather than just the abnormal value.